We all know the term of dental implants, and dental implants are a very popular option for tooth replacement for patients. One of the things that really has to be understood by the patient is that just because you don't have a tooth anymore doesn't mean you stop taking care of it. Just like a tooth, if you don't brush and floss your teeth, if you don't take care of your teeth the right way, see the dentist for regular visits, you can develop gum disease, peri-implantitis, or gingivitis, and that causes bone loss and eventually tooth loss. Well, an implant is very similar. Once the implant is put in, if it's put in improperly, meaning that the doctor put it too deep in the bone, not at the right level of bone, or they put it in the wrong angle, they put it instead of up and down or at a different angle, they've angled too far out or too far in, or depending on implant types, and there's all different types of implant systems. There are premium implant lines, and then there are implant lines that are less expensive, that come from different parts of the world, that are made very, very cheaply, for lack of a better way to say it, that don't have proper components to them or surface coatings of the implant. All of these things can cause the patient to develop inflammation of their gum and bone loss around the implant. Now that a patient's had an implant and they've spent the time and the effort and they've gone through the procedures and the money to get this done, and to be developing gum disease or bone loss around the dental implant, just like a tooth, will also lead to loss of the implant. We call this peri-implantitis. Peri meaning around implant, the inflammation around the implant, or peri-mucositis. Kind of like you get inflammation of your gum from not brushing, gingivitis. Peri-mucositis is, peri is around, muco is the tissue around the implant, and sitis is inflammation. Peri-mucositis, this gingivitis around an implant, can lead to peri-implantitis, bone loss around the implant, and loss of your implant. There are ways that we can, for lack of a better way to say it, salvage the implant. I established a protocol on how to treat this. As a matter of fact, we've published a paper in a peer-reviewed journal on the treatment of peri-implantitis in the all-in-4 treatment concept, but we've also done this around a single tooth and multiple teeth also. And it's a series of procedures we do, done at one time, okay, where we reverse the effects of bone loss around the dental implant and prolong the life of the implant, and many times eliminate the situation of peri-implantitis and get you back to health. As a matter of fact, we're so confident at Start Smiling Implant Centers that we can reverse this problem, that when I do this for patients, I guarantee it, meaning that if I can't reverse the effects of peri-implantitis and repair your implant, I will replace your implant for free. That's how confident we are in what we do. We've been a leader in the treatment of it. And I know when I can reverse this and when I have to say, I'm sorry, Mrs. Smith, we have to take the implant out and start over. Many times I am referred complications. And there are various kinds of complications, not just peri-implantitis. There are aesthetic complications. Right here in the front of the mouth, a patient had an implant put in and the tooth is too long or the tooth is too wide. And a lot of times it's not like teeth. So I can't do an orthodontic procedure to move the implant because an implant doesn't have a ligament like a tooth does. A lot of times we have to cut the implant out and start over again. And that's very, very problematic for a lot of patients to go through. Not only is it multiple procedures to do that, now we're dealing with all of the effects of the prior surgery, scar tissue formation, fibrous tissue, and all of these things play a role in wound healing. So if you're having any problems at all with your dental implants and you require any kinds of problems like this, we are the people that can help you reverse this and get you back to normal health and enjoying your dental implants for life.